So today I'm going to tell you everything you need to know about microdosing Ozempic, Wegovy, Mounjaro, and Doesnt. Have you ever thought about microdosing these GLP-1 medicines? Well, if you have and you have questions, this is the video for you. So maybe you're thinking about microdosing because you don't want to be on these medicines forever, or because they're so expensive and it's a way that you can still be on the medicines but take it less. Or maybe you're thinking about microdosing for reasons I can't even imagine. But be sure to tell me in the comments because I'm dying to know. So first, why did we even talk about microdosing? Where did that discussion start happening? Well, once upon a time, there was something called magic mushrooms. That's right, psilocybin. Magic mushrooms, or psilocybin, actually has a dual effect. It has two parts. One part is the hallucinogenic effect. The other part has an effect on your mood, how you feel about things, and an effect on your thinking, a cognitive effect. Some people microdose magic mushrooms. Wow, that's hard to say. Some people microdose magic mushrooms because they want to get just the mood effects, less anxiety, less fear, or the cognitive effects, so they change their thinking about a certain trauma, let's say, without getting any of the hallucinogenic effects. But what about weight loss drugs? Can we use microdosing with these? Can we actually apply microdosing to other medicines? Well, let's talk about what it really means to do microdosing. Microdosing means taking less than the recommended amount of medicine. When you take a microdosed version of this medicine, that means that you are taking less than what we call the therapeutic dose, which is the dose at which the medicine has its intended effects. So in other words, the dose at which you actually get that blood sugar control and you lose weight. So what am I actually saying? What are you actually saying, Dr. O? What I'm saying is that if you take these GLP-1 medicines at lower than the recommended doses, you may not get the therapeutic effects you hope for, the weight loss and the blood sugar control. And so microdosing these medicines doesn't work because you're going to be taking the medicines at doses where the medicine does not work in your body. If you're taking Ozempic 1.7 milligrams every week and it's working and giving you the intended effects, if you drop that to below the recommended amount, less than 0.25 milligrams, it's not going to work. I'm sorry. There's going to be some people who find that taking just a little bit of the medicine actually does have that intended effect. But that has to do with your own body biology. But for the most part, most people are not going to respond this way. I really don't want you to be the bearer of bad news and totally depress you, because guess what? There's hope. I have more tips and tricks on how to succeed on these medicines, including keeping the weight off. Be sure to watch my follow-up videos where I'm going to be talking about how to keep the weight off. Yay! And remember, anything I say and you would like to pursue further, you should discuss with your doctor. So I'm Dr. O, and this is the Dr. O method. If you're interested in these sorts of videos and you want to see more content like this, please be sure to subscribe. And if you want to know when I post a video right away, make sure you turn on your notifications.